Hello to everyone. My name is Dr. Eduardo Javier Houghton. I am from Daisy Foundation and Bernardino Rivadavia Hospital from Argentina. And I will present to you this study called Risk Factors for Hemorrhagic Adverse Events in Percutaneous Transhepatic Biliary Drainage, a prospective multicenter study. We know that the PTBD has hemorrhagic adverse events in 3 to 27%. 6% of them are severe, of which 2 to 8% are related to arterial injuries. These events are due to multiple factors like hepatic disease, systemic conditions, technical aspects. To validate those risk factors and to evaluate the level of risk for each of them, a prospective multicenter study was designed to estimate pre-procedural and intra-procedural PTBD risk factors for hemorrhagic adverse events. The inclusion criteria were all adult patients who required a PTBD for any cause. The exclusion criteria, patients who had received a previous percutaneous or endoscopic biliary drainage up to a week before the current procedure, patients unwilling to participate, and participants who died within 3 days after PTBD because of unrelated causes. This is a flow chart of a study that took place between 2015 and 2020. 309 patients after data collection, 5 patients were excluded. So finally, 304 patients were included. The exposure variables were defined as the number of punctures and passes performed during the PTBD. The hemorrhagic adverse events were hematomas, hemophilia, hemoperitoneum, among others, and several variables were controlled. These are our results. We found a mean age of 63 years old with 53.5% of female. Hemorrhagic adverse events after the procedure appear in 13.5%. According to the Society of Interventional Radiology Adverse Event Classification, 9.5% were grade B2, 3% were B3, and 1% B5. Hemophilia was the most frequent adverse event, appeared in 75%, and mortality related to hemorrhagic adverse events appeared in 1% of the patients. We found that 5 or more punctures and 10 or more passes were associated with hemorrhagic adverse events. Besides, the univariate analysis showed that intrahepatic tumor stenosis, bismuth more than 2, fatty liver or cirrhosis, vascular punctures, bilateral punctures, more than 2 catheters were associated with hemorrhagic adverse events. On the other hand, we found that patients who received coagulation correction had fewer hemorrhagic events. After the univariate analysis, we performed a collinearity analysis to assess if there were any correlation between the variables, and we found that punctures correlated with passes and the amount of catheters correlated with punctures. So these 2 variables were excluded from the initial multivariate analysis, and the punctures and the amount of catheter were included in this analysis. This slide shows the initial multivariate analysis, where we can see that the variable 2 or more catheters loses its statistical significance in the presence of the other variables. So this is the final multivariate analysis that shows that the intrahepatic tumor bismuth more than 2 increases the risk of bleeding complications or hemorrhagic adverse events in 2.4 times, the fatty liver or cirrhosis in 3.7 times, the vascular punctures in 4.1 times, more than 5 punctures in 2.5. And those patients who received a coagulation correction decreases the risk of hemorrhagic complications or adverse events in 5.5 times. With these results, we can achieve some recommendations as follows. Drain with as few catheters as possible, as more than 2 catheters increases the risk of bleeding complications. Avoid bilateral drainage unless it is absolutely necessary, because bilateral access increases the risk of bleeding complications. assess the choice of the access site in each particular case. We found more adverse events in the right side. Reduce the number of punctures and passes to the minimum possible. In patients with borderline coagulation parameters with risk factors, correct the coagulation first. Use ultrasound, Doppler, and as well as any method that allows to reduce punctures. That would be all. Thank you very much for your kind attention.